Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Parkinson's disease is a progressive neurological condition which affects movement. Smooth and coordinated bodily muscle movements are made possible by dopamine, a substance made in the brain. According to reports on various Parkinson's websites, about 7 to 10 million people worldwide have Parkinson's disease. It usually occurs in those 60 years and older and is 1.5 times more likely to affect a man than a woman. About 4% of people diagnosed with the condition are below 50 years old. My guest is a member of the International Parkinson's and Movement Disorders Society, consultant physician, neurologist, and the medical director at Evercare Hospital, Lekki, Lagos. Dr. Femi Daniel, it's great to have you again on the show.
Nice to see you again. Mary, thanks for having me here.
So obviously, something with dopamine is a problem in the brain. Can you throw a bit more light on that?
Thanks. So, neurodegenerative conditions are a group of issues that affect brain, just the same way that, neuro means neuron.
That's nerves.
Nerves. Degeneration means wear and tear processes. This can affect every organ, every bodily tissue. It affects the eyes, it causes some weakness in vision, and then so what it happens in Parkinson's is this group of cells that produce dopamine undergo a progressive loss or, death. They die in very, very, progressively and
bit by bit.
Bit by bit, so that over many years, what you have is a gradual loss. The amount of dopamine available for normal function is too inadequate. And dopamine is not just responsible for good posture and movement, but it's also...
Yeah, it's responsible for happiness.
That's right. So mood and even the speed of, processing information.
Okay.
It's dependent on that. And so whenever you're dealing with Parkinson's, it's easy for you to immediately define it by the issues that relate to posture, movement, and, but we also recognize what we call the non-motor aspects, non-motor symptoms in Parkinson's disease. These are things that have nothing to do with the mood and thinking process, things like constipation, things like loss of smell.
So now you're describing the symptoms.
That's right.
Loss of smell.
Loss of smell is one of them. So what you have is a manifestation of symptoms that depend on this particular chemical. But by definition and by common knowledge, the most dominant features are the posture-related issues with the tremor, the slowing of the movement, the postural instability, and the tendency to fall. All right. So whatever you have actually depends on, whatever the individual presents with, usually is a dominant, what is more dominant. But many times, because of how limited clinical skill, limited clinical how limited it is to evaluate patients clinically.
The perception.
That's right. You may have, by the time you're seeing a patient with the motor features, studies have shown that they've lost about 80%.
Which means a lot has gone under before you notice that this person has a problem.
That's right. So you're having, almost 70 to 80% loss of the cells that produce this chemical by the time. That's why there is now this need to, spot it on early with some new radio.
Okay, let me just pause you there and talk about who is susceptible to this disease. Obviously, age is an issue.
That's right.
Because you spoke about wear and tear.
That's right.
Does it mean like every single one of us could have Parkinson's?
So one of the things that we have to let people know is that age is not a cause of any disease.
Okay.
Age is a risk factor because, as you've said, wear and tear is an age-related thing. The longer it has gone on, the more you're likely to see the features that come from it. Because, you see, wear and tear is something that happens to every organ. It happens to your car.
That's why we have wrinkles.
That's right.
That's why I want to ask, is everybody going to get this thing?
So in the end, it's not everybody not everybody will. Everybody will have some form of wear and tear process, degenerative process. But in some people, so Parkinson's becomes the one. So they know that those who have a genetic predisposition to it, because it runs in families. All right, so there's the genetic, there's the age-related, and then there's exposure to certain kind of toxins, especially pesticides, that may predispose. Trauma, especially amongst boxers. especially those who have repeated head trauma. That's
Muhammad
right.
Ali
so
for
that's
you.
the typical example of persons who have and who immediately give the impression that, head trauma can. But typically, we do not know the cause. We don't know why this person will lose his dopamine levels. It is the cells of that brain. They call them substantia nigra cells. They're a group of cells that specifically produce this chemical. We don't know why it is so. But it's the same reason why someone can have dementia as a condition. It's the same kind of process, but with a different set of cells involved. But these are degenerative processes of the brain.
If it's so obvious that dopamine is a big issue in this matter, can't the person just get shots of dopamine or something, or they put one slow-release dopamine
You're beginning to
in
ask
his
the
body?
treatment plan for Parkinson's, and that is what it is, Mary. That's what it is. Because the most common drug, the most reliable drug we use for Parkinson's disease is a drug that has what is called levodopamin. And levodopamin is what chemists call an isomer that is able to penetrate the brain. But it almost always has to come with another drug called carbidopa that helps to let
That is like a catalyst for it to go
let
through.
It go through and be available to the brain.
Blood-brain barrier, right?
Very good.
Okay.
Yeah. No, but you should have a degree in medicine soon.
Okay, my next question.
Yes.
It's a bit delicate because of what you said about the condition having existed before the motor symptoms begin to show.
Sure.
I was wondering, probably this thing cannot be stopped because it's progressive. Yeah. It keeps on going and going. But is there no chance, maybe now or sometime in the future, that it can be prevented so it doesn't even start at all?
Okay, so we're describing what they call modulatory or neuroprotective approach, which is the basis of research all over the world now, especially with Michael J. Fox Foundation. They are looking for biomarkers and even drugs that can actually reverse or slow down the process of degeneration. So far, none. But there are enough things that people are beginning to see. It's surprising to hear that smoking and coffee drinking, for instance, are known to be potentially protective.
Potentially. Yeah, because I had a discussion with somebody last week, and she was saying that smoking can increase dopamine, but it's the kind of thing that will shut you down suddenly.
So it's a very
in the near future.
All of this is research. I need you to know that even antioxidants that are found in vitamin C, vitamin E, and even vitamin D have been found in some studies to help prevent neurological damage or progression of neurological illnesses. But none of this has gone into mainstream, guidelines to say this drug has been found to be useful in preventing this. So for now, you supplement dopamine through this drug I have mentioned and a couple of other drugs that actually act on the same site just to give the person some level of comfort. Because most of what you do when you make that diagnosis is you have to relieve and make life a quality, give more quality to life and reduce symptoms as much as possible. Remember, that's right. So the analysis or the evaluation of a patient with Parkinson's goes beyond the postural movement. You recognize them by what they say and what you see on examination. So he's first of all slow to answer your question sometimes because his speed of processing information is quite impaired. He may tell you that he's actually quite depressed because dopamine is responsible for mood.
For mood, yes.
So the higher the dopamine level, the more excited person is animated and talking. It's responsible for all the rush you get when you cigarette smoking and doing everything. But when it's low, you also have the low mood. So depression is a recognized complication of Parkinson's.
How many complications, let me not say complications, how many symptoms do you need to see and in what combination for you to make a diagnosis of Parkinson's?
So the classical symptoms are what you call bradykinesia or slowing of movement. That's right. The rest tremor. The tremor that comes on when the hand is not in use, but different from the one that happens when it's, all right? And then the postural instability.
Okay.
There's a rigidity that is associated with Parkinson's disease called a stiffness.
Can you see this rigidity? Is the person who complains, I feel stiff?
He feels heavy. He feels stiff. He knows he's slow. And he knows he feels unsteady. When he knows he can't fall. He has a tendency to fall. He will tell you that when I'm walking, I feel like I'm being pushed. And he stooped forward. and many times he's working with a shuffle. So you can actually tell those ones. But the ones you have a responsibility to pick out are things like constipation, things like difficulty holding you. He can tell, you can hear his voice is not very, very loud. His pitch is low. We call it hypophonia. And that's really because even the vocal cords have muscles that tweak when you're speaking.
Okay.
So over time...
And that's affected?
Oh, sure. By the time he's... You see, when you look at his face, it's not as animated. As you and I are speaking now, you can tell when the thought contents allow me to look happy and smiling, depending on what I'm thinking about. But this guy has a completely same expression, expressionless face. We call it a poker face. And that's because the muscles of the face are no longer as engaged as they should with the thought content.
And to think that people actually inject their face
with Botox
to stiffen their muscles. I mean, with Botox.
Yes, that is to prevent wrinkles, but that's a cosmetic aspect of things.
Wouldn't it
No,
somehow
it's not
affect?
the same thing. It's not the same thing we are saying. But what we are saying here is that of general loss of engagement of muscle function, slowing to engage muscles. It's not that the muscles are weak. They are just slow to engage. So the same way they pull saliva and drool because as we speak and as we talk, we swallow continuously. But these guys have a problem with even swallowing. And they're unable to keep, so they keep saliva in the mouth.
So how is this condition different from, say, multiple sclerosis or myasthenia gravis?
Okay, so etiology is what matters here. Etiology is the cause of a condition. I have described Parkinson's as degenerative. Multiple sclerosis is inflammatory.
Okay.
Myasthenia gravis is autoimmune.
These are three different causes.
Oh, very different, very different. But suffice to say that, it also depends on the part of the brain that is involved in any process. If you have an autoimmune process that affects the part of the brain that controls posture and movement, you can have what looks like Parkinsonism. Because you are dealing with an area of the brain, but this time around, it's not because dopamine is lost or deficient. These are the things that you call secondary Parkinsonism. For instance, I need to clarify something. So Parkinsonism and Parkinson's disease are two, it's like saying, Parkinsonism is like saying fever. Fever can be caused by malaria, by typhoid, by pneumonia.
So Parkinsonism is
a group
symptom.
of symptoms.
It's not the real problem.
It's not the real problem, it's a manifestation of something. All right? Meanwhile, Parkinson's disease is a particular type of condition that gives rise to Parkinsonism.
Okay, on that note, let's take a short break.
Okay.
Stay with us. We're coming back with more exciting stuff. Welcome back. It's Health Matters on Channels Television, and we're talking about Parkinson's disease. Now is the time that you call and ask those questions, you might have a lot of them, about the topic. You can call 0808-054-2233. It should be on your screen right about now. You can send email, moalale@channelstv.com, or tweet at CTV_Mary A. Parkinson's. Now, what I want to ask you is, does it, for example, compromise breathing? Because muscles are involved there too.
Yeah, but those are muscles that are not under conscious control. Breathing is basically like an involuntary thing that happens.
That's
Although you can actually have the muscles of the diaphragm involved, but not typically. Not typically as an issue. Most of what you want to worry about in Parkinson's are the complications of the immobility and the difficulty with swallowing that comes up with it, and the bladder and bowel symptoms that come up much later in the day sometimes. The dementia and the thought abnormalities like psychosis that can actually be associated with this condition. Every time you have a patient with Parkinson's, the first thing is empathy and the ability to extract the most important issues that require solution or some kind of relief. It's easy for people to be so particular about what drug to use and what drug to reverse, but the truth is that the drugs themselves at some point are no longer as effective in offering some improvements. So you have to think about things like, how do you help him feed? If he's got a difficulty swallowing, then you probably want to help him with choosing the meals, making them more palatable, or at the same time finding some other means of pushing food into the gut, bypassing the mouth. You also want to...
That would be like stage 5.
That would be, yeah. Usually, it's called, we stage it in 4 stages typically.
Okay,
all right?
let me pause you there.
Yes.
There's somebody on the line, Chinedu from Enugu. Hello, Chinedu.
Yeah. Hello. Good
Hello, what's your
afternoon.
question?
Yeah. My question is one of my siblings is having a serious headache and is having a brain issue. He's having a brain issue for a very long time. They said it's migraine something, but he has taken a drug several times for migraine, and he's still having the same issue.
Okay. I can tell you, even without being a doctor, Chinedu, that is not Parkinson's. But I will ask the doctor if it's neurological.
I actually didn't hear the question.
And it's affecting him both.
Go ahead. Okay, I think I've lost Chinedu. He's talking about someone who has a migraine and is using medication, but it doesn't seem to be helping. But I know that's not Parkinson's.
No, it's not Parkinson's.
But is it neurological?
Yeah, a migraine is a neurological condition. It's a recognized neurological. It's called a primary headache disorder. And there are certain features that allow you to make that diagnosis.
But he's not a doctor. So I
So it's difficult for you to agree with that diagnosis until he has been evaluated.
I was about to ask, how do you know that's the condition? Have you taken it
doctor.
to the doctor? But back to Parkinson's. Yes. Chinedu, I'm sure we will handle that condition in the near future.
Sure.
So we'll be back to you on that. But today we're talking about Parkinson's. When you start to treat somebody with Parkinson's who has come with the obvious symptoms, can that prolong his life?
Well, yes, it can. When you realize that the longer a patient remains untreated, the longer immobility persists, the longer he's allowed to stay in a position for too long, and develops bed sores, or develops urinary tract infections, or develops, infections and things that can arise from pure immobility. You certainly would help to improve his quality of life or prolong his life if you cater to his nutritional needs that have arisen because of the difficulty swallowing, difficulty chewing, and you're able to supplement his meals with high, meals of high biological value, rather than just say because he's not eating, he's going to starve, and get infections because his immunity is suppressed. So there's definitely a good thing to help, identify the issues that make them uncomfortable and then solve. Because you actually improve their...
Let's quickly take this question from Femi. Femi in Isherinoth. Hello, Femi.
Hello, good afternoon.
Good afternoon.
I've been wondering, for instance, if somebody has a particular illness, they can say, use that certain things that will boost certain things that are absent within the system. For this Parkinson, are you not saying there's no supplement, there's no food supplement, there's nothing at all that people who are undergoing this pain and challenges could use? Maybe it may not aid the recovery fast, but it can do something for them. Can relieve them.
And we were discussing that. He's talking about diet. Could diet be changed such that it will supply some of the dopamine, for example?
Okay, so when it comes to orthodox practice, your aim is to offer what research has justified, validated. I'm aware that there are lots of suggestions. That's what we'll call them for now. A lot of research is going into looking at diets as a means of reducing the rate of progression of many diseases. I'll give you an example. There's one they call paleo diet. Paleo diet is the meal that was eaten by the very, very early humans. usually about hunter-gatherers and all those times when
Whom they say were very healthy
That's
people.
right. So those kind of things, some quarters have touted that this is reversing some major neurological conditions, even multiple sclerosis. They have also seen that such things may actually reverse things like Parkinson's and dementia, but they have not come into mainstream. They have not been justified.
But those diets are not bad, are they?
They are not bad. And so because they don't harm, and there's no harm asking a patient to eat them if you find this. People come with all sorts of vitamins and things, but the truth is that you also want to be careful about encouraging this because excess of anything can actually give you a problem. So when you ask, we will give you the non-drug approach and the recognized drugs. Parkinson's is treated at non-drug, drug, and even surgical levels. There are certain kinds of interventions that are surgical that can help very severe postural issues, very severe tremors. There are about 5 groups of drugs you can use singly or in combination to treat Parkinsonian symptoms. And there are so many non-drug approaches. Advice, just telling people what to do to make life a bit more comfortable. You don't always have to take a drug that can hold urine.
Yes. What do you tell a patient to do for himself?
Okay, so for instance, if I said engage more in mental puzzles and discussions and things that can actually engage your muscles and thinking into crossword puzzles, board games in a competitive manner, those things kind of stimulate the mind into work. If we said, okay, you have a problem holding urine, why don't you have a urinal and you can just periodically empty your bladder? Don't have to wait until you are really, really urgent. You don't have to wait until you're really constipated. You can always have periodic laxatives. Always have exercises periodically. They have to be goal-directed, focused, just to make sure that muscles and bones...
But for somebody who is already shuffling,
yes,
what kind of exercise do you ask
so
him to do?
physiotherapy,
You can't run?
Yeah, so you don't have to... It doesn't have to be... You see, a physiotherapist... And Parkinson's is one of those conditions that require multidisciplinary approach to care. And that's one of the things we're trying to establish in neurology now in this country, because there's a need for more collaboration amongst all team members. Physical therapy, nutritional therapy, speech and swallowing therapy, psychological therapy. These 4 alone work with a neurologist to give a patient the most holistic approach to his care. All right? In all honesty, it's more rewarding when you have this kind of collaborative approach and seeing the patient in the center and allowing all of these guys have their interventions being meted out. There is always Parkinson's disease itself is, while the condition cannot be reversed or, cured, there is a lot of reward when you see a patient who's happy because many of the things that have given him a lot of discomfort have been assuaged.
Now taken care of.
Sure.
Well, that's perfect.
All right.
Thank you so much for coming to the program. I wish I could ask you more,
but
fine. This has really been educative.
It's been my pleasure.
Dr. Femi Daniel, everybody. Thank you at home for calling in and for watching. Thank you, Femi. Thank you, Chinedu. Have a lovely day. I am Mary Alale Yusuf.